Hey everybody, thank you so much for joining us today for our webinar. We're going to go ahead and wait just 1 or 2 more minutes for the last few people to join, and then we'll get started. So just hang tight. Thanks. All right, why don't we get started then? Thank you guys so much again for joining us for our webinar today. The content of the webinar today, as you know, is on death, and definitely a very serious but important topic to talk about. Yeah, it's a process-oriented approach to grief treatment. My name is Tyler. I'm the Communications and Outreach Specialist for NASW Pennsylvania. Before we start, I just have a couple things I want to go over. If you've been on our webinars before, you've heard this. So I'll try to keep it brief. So this webinar is for NASW-PA members only. And to benefit you as our members, we're offering one free continuing education credit for attending. We offer these free webinars for members every month. So except December, which the goal of these webinars really is just to make it a little bit easier for you as our members to obtain your continuing education credits, which I know a lot of you are probably really familiar with, being the end of the licensure cycle, trying to get all your credits in. So we hope this helps, This means really that over the course of the 2-year licensure cycle, if you attend all of our webinars, you can get up to 22 of the 30 credits you need, which is really pretty great. So please keep in mind that per the state board's regulations, you have to attend at least 50 minutes, that's 50 minutes, of the 1 hour in order to receive the 1 CE credit. So, please try to stick around for the whole thing if you can. At the end of the webinar, I'll be posting a link to a quick online evaluation that we need you to fill out before we can send over your certificate. So it'll just take you a minute or two to fill it out and submit it. And then please, once you submit it, allow our continuing education department a few days to get in touch with your certificate. Don't worry too much about it being the end of the licensure cycle. As long as you've taken the course before the date of the end of the licensure cycle, you can count it, even if you don't have the certificate right in hand. So, and you'll need to, keep records of your certificates for a couple years, just in case you were to be audited or whatever. But yeah, just give us a little bit of time, as we do have to send out a large mass of certificates right after these webinars. So it could take a few days. If you have questions during the webinar, please feel free to type those into the questions section on the control panel. We definitely, appreciate the interaction piece during our webinars. So, and I know our presenter today is going to be leaving some time at the end to answer questions. So please feel free to interact in that way. Yeah, so I guess with all that, I'm going to go ahead and introduce our presenter today. Our presenter is Julie A. Geistwhite. Julie is an adjunct faculty member at Pennsylvania State University's Mont Alto campus. She holds a BA in Family Studies from Messiah College, MSW from Temple University, and a Doctor of Philosophy degree in Social Work from Widener University, and a PA Social Work license. Prior to transitioning to academia, Julie developed and facilitated a funeral home community-based bereavement program for over 5 years, as well as worked 15 plus years in various healthcare settings, such as nursing home and hospice, along with briefly in private practice. Julie's passion for death, dying, and bereavement care, particularly competent death-related practices, led to the development and validation of the profession's first known empirically based instrument to assess and refine social workers' knowledge and skills in death-related care, along with evaluate training curricula's alignment with societal needs. She's in the process of developing a continuing education certificate in death, dying, and bereavement care at Pennsylvania State University's Mont Alto campus for existing practitioners and students interested in gaining further skills in an increasingly relevant field of healthcare and mental health practice. So Julie has a ton of experience studying and teaching on the topic of death, dying, and bereavement. So we're super excited to have her today. And so with that, I'm going to go ahead and pass it over to you, Julie.
Thank you very much, Tyler, and I thank each one of you for taking the opportunity to attend our session today and value very much your insights and the growth that you may experience through this time, and that you walk away from the webinar with at least one or two new skills, thoughts on how you can better enhance and assist individuals that are dying and grieving. Typically, the death-related issues is not something that anyone really much enjoys talking about, but realistically, working with death and dying is an inevitable aspect of the social work profession. If not before, by the time within the first year following graduation, approximately 70% of social workers will, from the child welfare setting to the hospital setting to the counseling setting, will encounter clients coping with a upcoming death experience or the recent loss of a loved one. And knowing the best practices and best ways to provide them the ongoing support and guidance through the process is very much relevant and pertinent to the profession. The most recent data suggests that less than 50% of undergraduate social workers leave their BSW programs with a comfort and confidence in assisting in assessing death-related care issues. At the same time, a most recent nationwide study of social workers suggests that only 22% of existing practitioners feel comfortable addressing end-of-life issues. Definitely shows there's an area that we as a profession need to enhance our skills to help align all that we're doing with the mission of the profession, and particularly as our aging population continues to grow. By the year 2030, the projection is that 1 in 5 individuals will be over the age of 65. Along with that, these individuals that are over the age of 65 are anticipating and expecting that they're going to seek and receive competent assistance from social workers from the undergraduate level to the doctoral level. And I very much value that your willingness to attend this session and learn a few new skills and how you can help others throughout the way. The agenda for our session, very much I'm going to spend a little time kind of reviewing the objectives in the background. Then spend a few minutes briefly doing some self-reflection on our own understanding of working with death-related issues, history of grief treatment, and then I'm kind of move into a discussion of the 3 process-oriented approaches that are on the focus for today. I'm looking forward to the chance very much. This session is interactive. I'm going to have a number of videos and be looking for your feedback on those. There's a number of polls along the way to kind of assess, hey, what do I think about this, or what do I know along the way? So I hope you find it as an enjoyable experience. And we'll go ahead and begin with a short quote by C.S. Lewis from his book entitled A Grief Observed, after the recent death of his close companion and wife Joy. Sorrow, however, turns out to be not a state but a process. Adjusting to the death of a loved one is very much a progressive experience. The phrase that we maybe have often heard, time heals all wounds, that is very challenging to hear and interconnect with an individual that is trying to adjust to the loss of their spouse after 50 years. How's time going to heal that hole in their heart that has been part of who they are and their identity for 50 years? In a sense, it's not really that time heals all wounds. It's really the nature of the activities that the person chooses to move through and process comprises that protective mourning. It's not really the time, but in a sense is what they do with that time that makes a difference in how individuals adapt and adjust to the loved one. Our objectives for our session today is definitely we're going to compare and contrast 3 process-based approaches of grief treatment. They're in a sense beneficial ways, and our evidence-based data suggests that they kind of make good use of that time when someone's moving through the grief process. Discuss the relevance of understanding the approaches to competent practice, and then explain how you anticipate applying one of the approaches to current or future practice. We're getting started. Take a minute to consider, on a scale of 1 to 5, what is your current knowledge level of evidence-based grief treatment methods? Would you say you're more on the 1, novice, 2, 3, kind of in the middle, 4 or 5 in that expert realm? And if you feel like you want to share, don't hesitate to type something into the chat. I will say in my data, in prior studies that I have completed, most social workers kind of fit somewhere between the norm of the 1 and the 3. It's kind of on the average of what I have found. So if that helps you to feel where you are, but that's also what brought you here, in a sense, to get a better understanding of the knowledge and the skills that are important to caring for those that are dying and grieving.
Julie, I'll just jump in. Sorry to interrupt. Looks like we have some people typing, quite a few 1s typing, and novices, and you know, we definitely appreciate the honesty from our attendees today. 1s and 2s are very common.
Absolutely, absolutely, and like I said, as part of my dissertation, I actually did a study of 30,000 licensed social workers, and of the 2,500 plus that completed the survey, on the average, 1 to 3 was where most social workers are. That shows that this is an area of exciting growth for us as a profession as we move forward in confidently caring for the rising, dying, and grieving population. Thanks, Tyler. It's good to know that. And nobody should feel like embarrassed on being on that 1, because we all have areas where we're on the 1. In guiding our discussion today, I wanted to just provide 2 core terms for us. Grief is the psychological, behavioral, social, and somatic reaction to someone's loss. And the mourning is that conscious and unconscious, the processing of integrating the loss into life ongoing. Grief is, in a sense, that sense of you're thinking about it, and the mourning process is kind of more of the doing and the action. It's a way to kind of separate those a little bit. In the context of the profession, the core values of the NASW Code of Ethics in our welfare enhancement mission focus very much on the competency principle in developing and enhancing our professional expertise. And the NASW-PA webinars are an excellent way for all of us to explain our professional expertise in various areas. Another core component of competence principle is applying to practice, in really staying up to date on what's occurring in the research, what societal issues are pressing and needs that are going to be kind of coming to the forefront is an integral aspect of competent practice. Another aspect of that is kind of understanding yourself. I always tell my students that really to provide proper care to individuals that are dying and grieving, you in a sense need to know where you stand. Knowing yourself is the core and fundamental of providing competent practice. So we're going to take a minute to think about this. How do I approach grief personally and professionally? I'm going to take about a minute or two and just let you reflect and maybe make some notes on a piece of scrap paper on your napkin while you're eating lunch, whatever. How do I personally cope with death? Are you a person that avoids topics about death? Are you a person that pushes it under the mat? Are you a person that is open to talk about those type things? Do I view grief as an event or an experience? Is grief a systematic, individual, or both occurrence? In a sense, does grief involve a system, family system type perspective, just the individual, or is it a mixture of both? And how do I approach grief issues with clients? So I'll take about a minute and give you a chance just to kind of think on that yourself. If anybody feels like they would like to share anything with the group, don't hesitate to type it into the chat, and Tyler can share the thoughts with us. Okay, I think we'll go ahead and move forward in the interest of time, but I encourage you, particularly questions 1 and 4, how do I personally cope with death and how do I approach grief issues, to continue to reflect on those during the remainder of our time together, and also throughout your days, and thinking about how you approach people, talking with family members, because really something that we need to keep in mind is that how we kind of approach working with those issues makes a difference in our openness and our ability to assist clients.
There are a few responses here, Julie, if you'd like me to read those.
That'd be great.
Yeah, first one, I view grieving as a process.
Mm-hmm.
In response to the second question, this person, says, I think it's both.
Mm-hmm.
Experience and individual start where they are.
Perfect. Exactly. And that's really what I'm about ready to get into. That very much we all need to keep in mind that theory serves as a guide, and it's not a barrier to effective treatment planning or intervention. Really starting where that client is. What is the best interest of that client? Because grief is such a complex, personal, and culturally influenced process that is both systemic and individual based. It's kind of an intertwining of both. And as our discussion moves through the 3 different chosen methods, we're going to kind of see how society and philosophically and theoretically, the profession of thanatotheology, which is death, dying, and bereavement care, has kind of evolved, and where grief approaches have kind of gone along the way. So we're going to start with a little bit of some background of good old Floyd. The early phases in the early 1900s, focusing very much, and said that adjusting to the loss of a loved one is very much a grief work. It's kind of working through that grief. We're kind of confronting the reality of that loss going over the events that occurred before and at the time of the death. And then also we're working to kind of detach from the deceased. In a sense, Freud focused on the fact that we need to withdraw our emotional energy from the relationship with that loved one. Progressively, particularly in the late 1980s, like 1990s, a lot more research and a lot more theories started coming to the forefront that, hey, we need to move beyond that withdrawal of the emotional interest, and maybe what has come through on some of the phases and the task-based models that were in existence during the 1940s and 1950s, because the tasks were seen as kind of passive, and they overlooked that sense of struggle and the fact that grief goes beyond the emotional to really encompass the cognitive, the affective, the behavioral, the spiritual. It's very much an interactive process. And that's really what brought us to our focus today on the process-oriented approaches of meaning reconstruction, the two-track model, and dual process model, which in a sense you'll see as we're discussing each one, kind of build on each other and maybe take a little bit of pieces, working towards the most up-to-date model, which is the dual process model of working with individuals that are coping with the loss of a loved one. The meaning reconstruction model by Niemeyer, that some of you may be a little bit familiar with, has two aspects. It focuses very much on the meaning making and the meaning finding. Niemeyer emphasizes very much that we need to reconstruct that meaning through reflection, very much reconstructing that sense of where things are and what a person's meaning is involves a lot of conversation. The best approach to fostering that meaning reconstruction comes through, in a sense, a narrative approach. He focuses very much on the reconstructing a life purpose, which is, in a sense, guiding the individuals as they reconstruct a world of meaning that's been challenged by the loss, and then redefining those continuing bonds. It's not the emotional disconnection that Freud talked about. It's like, how can we redefine, how can it, in a sense, as I've told individuals, you move forward in each day, keeping that person inside of you and keeping characteristics of that person with you. And then we focus very much on the narrative processing of restoring a sense of autobiographical coherence that's been disrupted by loss. Within treatment, you're going to want to explore that emotional side first, kind of in a sense find out how are they making sense of it. So then you can see into the cognitive aspect. A lot of times having individuals construct a brief biography, kind of like a table of contents of their life story, to see how what their experience, in a sense, fits into their overall life story. And it can be, in a way, looked at as a meta theory. To give us an example, a chance to kind of look at this for a moment, I do have a short video that is only like about a minute of an older adult that is discussing her experience after returning home from the funeral home when her husband died suddenly of a heart attack one morning in their home.
The most painful thing I think of all was not when I took the children in to see him before we left the hospital, but walking into my kitchen with my 5 children who hadn't been together for 10 years, but I was alone. That moment as I walked into the kitchen and sat down, a light went out, which I don't think will ever go back on.
And maybe if individuals, she's kind of like seeing that sense of she lost her husband and like making sense of, okay, the thought came to her that that quote of the light went out and that will never go back on. In a sense, she's kind of starting to beginning to realize, hey, I'm going to have to adjust, and that light of who I was is going to be different. But she's very much, you can tell, valuing the fact that she has her family there and kind of trying to make sense of what's happening. What other thoughts do people have that you feel comfortable sharing in relating to how Nehemiah's meaning reconstruction may connect with that little brief video clipping?
There are a couple, questions, responses, and stuff. One person just mentioned, one other key factor is knowing, assessing in the being, what is dangerous grief, as multiple losses, no support system, being in a codependent relationship with the deceased, suicide ideations, loss was a result of a violent death. Just some examples.
Yes, very much those aspects that can more compound the grief process and create more of a complex grief aspect are very integral as well.
Yeah, and then just a couple other questions, but I think, are we going to try to save questions for the end?
Okay, but great. Yeah, and definitely very much what we're focusing on is really much that uncomplicated grief aspect. The individuals that have those kind of compound loss, maybe they've come from an alcoholic history, have coexisting mental disorders, they would require more highly skilled intervention than really what can be found in these three process-oriented approaches. Doesn't mean that aspects of these couldn't be used, but there's more fundamental factors to take into consideration and assessing those. And thank you for reminding us all of that. Our next model and the next two models actually do look into some of those aspects a little further than what the meaning reconstruction aspect does. The two-track model, which was developed by Rubin in the late 1980s, really focuses on the nature of the relationship. It builds on that, reworking the aspect of the deceased and the relational aspect, and trying to take more of a bifocal perspective. The loss process is conceptualized along two distinct but they're interactive tracks, which is the biopsychosocial functioning and then continuing bonds. And the information that was recently submitted in the chat regarding the other coexisting conditions very much hones in on those continuing bonds that we do need to look into. Some of the key principles with the two-track model is the relationship to the self and the world, the nature of that ongoing relationship with the deceased, and then the death story. To kind of give you a visual image, track one, which focuses very much on the biopsychosocial functioning. In treatment, you'd be looking at terms like recovery and growth and their continuing difficulty of issues with anxiety, depressive effects, relationships, self-esteem. Very much changes in feelings of anxiety, somatic concerns, they're fundamental to the early periods of experiencing a loss of a loved one, and can be kind of compounded and worse for an unexpected loss, like an auto accident or the death of a child, which is very untimely. Something to keep in mind. It's not really the two-track model that can be taken as this is the way it should be from day one. It's kind of a progressive, watching the process evolve. The track two looks at that relationship and the continuing bonds. Literature suggests very much, as we know from our understanding of attachment, if there's a secure attachment relationship in the couple, there's going to lead to more positive and kind of increasing moving forward in the grief process among individuals. So in a sense, the track two issues kind of shape the track 1. The richness of the bond with the deceased is going to influence that functioning. If there's more issues like abuse that had happened, that's going to influence the depth and the length of and the complexity of the biopsychosocial functioning components that may warrant the need to look into more expert services to deal with a complex grief. Very much the track 1 and track 2 are not separate. They're very much an interactive but yet distinct. Track 2 is going to be looking more at the, in a sense, how am I going to acceptance of the death that's transformed the connection of the deceased, versus track 1 that looked at recovery and their growth as a person. Track 2 looks more at that acceptance aspect and the connections growing along the way. 4 orientation points to keep in mind with this would be the changing in those fixed patterns of functioning. Are they progressing? At least, I mean, as long as they're making some progress, that they're not going backwards in all areas or the majority of the areas. To accept the reality of the loss, that we might notice an increasing psychological focus on a deceased in a relationship. A lot of individuals will not experience that rise. It's kind of like goes up and down, because grief is very much a roller coaster. Literature and professional experience notices a lot of times around the 6 to 9 month period. Sometimes that sense of the reality of the loss starts to kind of hit home more than it has in the initial time, because you're so busy with all of the preparation that needs to be done and the interactions around you and the socialization that's kind of culturally prescribed, that once things slow down a little bit, really that sense kind of comes to the forefront. Gradual acuteness really subsides. It's kind of the 3, when you notice that subsides, and then weeks or years later, you may notice that the individual has a new level of organization. Really, it's the management of that life connection that comes down to it, the ongoing relationship, and then with the complex memories and the needs of the person that's died, how they're kind of creating a new balance and functioning with the relationship and the needs that are associated with maybe what that person did. Their ability to function more, in a sense, independently, but still interacting. It doesn't mean that on the anniversary that we're not going to have some step backs. But in a sense, individuals appear to be progressing and not staying stuck in a fixed pattern in a way of what they are. I'll give you an example of this. There's a clinical study. This is taken from actually an article written by Rubin, Whitson, and Madosco. It says, life has changed forever. 2 weeks ago, my daughter was killed in a road accident. 2 years ago, my daughter was killed in a road accident. My life was shattered. I wanted to join her. I couldn't stop thinking that she is dead, my beautiful girl. My family was very worried about me, and I couldn't pull myself together. It was when my son, then 15, reminded me that I forgot his birthday. It hit me at that moment, and I made a decision to continue with life and think of the family that needed me. I functioned that there is not one day that I don't think about my beloved daughter. Her memories are with me, and I cherish them in spite of the pain. I realize that my decision to continue is living with the pain of loss. In a sense, she kind of worked that intimately associated with that relationship and the memories, kind of realizing and going backwards from looking at the 2-track model, that sense of familiar responsibilities and the meaning structure. Gradually, the individual came to kind of the forefront that really that preoccupation and was taking away from others in the family, and like, hey, I'm still here. It doesn't mean that that person's not still with me, her daughter's not still with me, but she's thinking about, okay, I do need to attend to other things that are happening. How would you relate the case study to I'll put up there again, to the different 2-track models? And feel free to type any thoughts into our chat.
I thought it was interesting. We had one person type in and say that she tries to prepare the clients for the third week after their loss. That seems to be when their real sort of new life begins,
Mm-hmm.
after all the visitors and donated meals are gone.
Yes, yes, that's very integral. There's actually a book out there. It's called when they, I believe it's like something like when they stop serving all the casseroles, when the casseroles stop arriving. That's really when people start to realize life is going to be different from this point forward, and sense of what's my new normal going to be, and how am I going to be looking at my functioning in that relationship with the deceased.
Hmm. Another person said, I like Nehemiah's focus on developing a different relationship with a loved one who has died.
Mm-hmm. Absolutely. That sense of that narrative can very much hits home, and that's, I do find myself too in working with clients not sticking to all of the components of one model. Sometimes it's integrating different aspects, as we do in other type of clinical situations, to what's best is in the best interest and what fits the needs of the client. Absolutely. We'll move on to our third process-oriented approach, which is the dual process model, which was developed by Strobe and Schutt. And then they revised it in 2016 when they realized, hey, we're forgetting and we overlooked really the stress overload aspect of working with grief. The dual process model builds on the strengths of that confrontation avoidance aspect. It also serves to understand individual differences and the way people grieve at a deeper level than the prior methods did. Dual process model sees grief as very much a dynamic process, with it being central to the model, the oscillation between the loss-oriented and the restoration-oriented components of coping. It avoids very much that letting go or holding on to memories. A lot of times cultural differences do influence the behavior in this model, and over time that it does lead to an adjustment. Some of the key principles of the model that I'm going to share looks at oscillation, which is that sense of going back and forth. Am I kind of struggling with what I was going through, the processing of the loss, and then dealing with the secondary stressors and figuring out how to go with those, and then the stress overload component of it. But this is the original dual process model from back in 1999. The loss-oriented component is more the intrapsychic and interpersonal processing of the experience. It's that yearning, that crying about the death. And the restoration-oriented is looking at those secondary stressors, doing new things, the new roles or identities. For example, who's going to come and fix the garage door now when it's broken? Who's going to help me take out the trash when I can't lift the trash bin? Who's going to shovel the snow? Looking at those two aspects, like, all right, I'm trying to work through this on one component, but I know I've got to deal with these other aspects on the other way. And that oscillation back and forth, dealing with everyday experiences. Then in 2016, Strobe and Schutt came out with a revised model, and noting very much that they overlooked in the original model that dual overload, the mental and the physical health complications, that really that sense of stress of what's happening. We've got the chronic grief and the absent grief periods, and trying to move through those. And really, where are we? And we can't forget the fact with that oscillation that it creates a third variable there of the stress and how we're going to work through the mental and health physical complications that are related to the stress that comes from grieving the loss of a loved one. The death of a loved one, particularly a spouse, is considered the most stressful life experience an individual will ever encounter. It's not something that we get up the next day and go on with our life in the way we did. Even though typically societal expectations are that, oh, even within the first year, you're going to be back to the typical functioning. Or I've had individuals in their 60s and 70s or 80s come to me and say approximately 3 weeks after their loved one died that people are trying to encourage them to start dating, and just how much stress that creates from this, like maybe thoughts of what society's saying to what they feel as a person is what they want to do and where they want to be with their grief process. And helping people to understand that when it gets too much to handle, that you just need to take a break and do what's right for you. To give us an example of this one a little bit, I have a brief clip to share of an individual that is continuing to adjust to the loss of her 16-year-old son who died unexpectedly from the flu virus, and kind of trying to adjust to what everyday life's like and going on and doing various things now that he's not with them any longer.
Get together, sometimes just sitting down for dinner in the beginning was very hard because there was an empty chair. When we would go out as a family, there was one missing always. You know, we'd go out on a trip or something. When we had fun, that's all I think of, is that you're having fun. It's missing. You would have had fun too, and you can't. So that's difficult. And that makes the whole experience of grief so hard. The fact that you can't enjoy your fun, you can't enjoy your pleasurable outings the way you used to because you feel guilty or because the missing child isn't there. And then we all turn.
Could capture a little bit from there, just that empty sense of the place at the table, and also the infusion of grief. Very much that we're kind of connecting with the dual process model, that grief work, breaking those bonds and this tie. There were things you avoided. A lot of individuals typically avoid going out to eat after they've experienced a loved one at first. Just they don't want to sit at that table by themselves, particularly if it was a spouse, or if they've lost a child and they're going to go in a restaurant and see other families out with their kids. That's just kind of more of a challenge than maybe they're ready to face at the beginning. And then the reality orientation you could see in the aspect of her attending to those life changes, in the sense that reorienting herself in a sense to what's going on and looking at the new sense of family that could be there. What other aspects did we see in the small clip there?
You know, one thing I saw that I wasn't really thinking about before this presentation, Julie, was the idea that the family kind of feels guilty for having fun, going out and doing something enjoyable, and feeling guilty about that because that other family member's not there.
Absolutely. And there's that sense of guilt, a lot of times even of smiling or laughing, that it just doesn't feel right. Individuals have said that I have no joy, or they'll say, I want my joy back. And progressively, a new sense of joy will come back. And I always give people that hope that it's that not the time heals all wounds, but it's what you're doing with your time to work through that grief that does help. And that oscillation back and forth, people's willingness to kind of go through the pain, particularly if it's an uncomplicated loss experience, can make a difference. The complicated loss and compound losses are going to have more dynamics that need to be addressed. And it's more of a progressive process that takes a little bit longer, but that's okay. As long as individuals are willing to work adjusting and coping with what they're confronting versus sweeping it under the mat, there's always sense of moving forward along the way. Now, to kind of summarize, as we're coming to the end of our time, the meaning reconstruction focuses very much on reconstructing that meaning of the relationship with a loved one. It's very much a storytelling type approach. The two-track model looks at the biopsychosocial functioning and that continuing bonds aspects, the two tiers and the interconnection between those. And then the dual process model is going to look at the loss orientation aspects and the restoration orientation, and then that dual overload of the fact that I've got so much on my plate that it's very common for individuals to have that sense of dual overload, and that sense of overload can kind of, in a sense, freeze you. That makes it more of a challenge. In a sense, the dual process model looks for a real wider perspective. It gives us those differences in the way people grieve and reminds us on the individuality of the grief process, but also can give a little bit of predictions on the good versus the maladaptive adjustments based on if someone's stuck in that dual overload, or if you're noticing that they're starting to move forward or things are changing from the loss orientation or the restoration orientation aspect. And there are always things to point out to clients if you notice aspects that are improving or work together on components that are confronting them as a hurdle in adjusting along the way. And as I mentioned at the beginning, and Tyler did too, I was going to leave some time for questions because I really would like to hear your thoughts on really questions along with how can I apply one of the methods to our current or our future client situation. I would really like to hear your thoughts on that aspect as well.
Yeah, so everybody feel free to type into the question section or chat section, and we can have some interaction. One question that came up a little bit earlier was, does grief always need to mean the death of someone, or can it be the process of grieving what someone may have thought a situation may have been, such as parents who end up having a child, diagnosed with autism rather than being neurotypical child?
That is a way that grief can be defined. The definition I used actually was from a book by Dispelder and Splickland that really focuses on working with just someone that has died. But that doesn't mean that grief does not apply to other settings as well. Absolutely. Grief and loss, both.
Yeah, another person just had a comment, about the idea of society rushing the grieving process. They said society's impulse to rush grieving is a reflection of our collective discomfort, which is just an interesting thought. And I think you touched on that a little bit, Julie.
I will say, agree very much. It's also that sense of what the social structure says we should be in the expectations. A lot of it goes back to some early grief thoughts that within a year you need to be out dating again, or people need to be back to their whole normal sense of personality. But over time, literature, theologically, we've come to realize that grief isn't a cookie cutter thing, that just like a diagnosis in the medical setting, it could be a diagnosis, but it's not something that people are going to move through exactly the same stages in exactly the same order. Because no two people have the same personality, the same characteristics, cope with or look at the situation in exactly the same way, or had that same attachment to the individual.
Another interesting thought that someone had mentioned and asked a question about is the idea that, like, sort of in our current state of technology, we have to think about things like deleting someone from your cell phone, or, I imagined something with social media, the idea that the account of the deceased still exists online. Can you speak to that at all, Julie?
I have limited knowledge in that area. I do know just briefly, minimally, that there are some ways that individuals can kind of go in and change someone's like Facebook page to a remembrance page as a way to kind of keep it active. But that's really my extent of my knowledge on that. That's really one of those areas that's continuing to expand. How are we going to respond to grief online?
Definitely, yeah. That's a really interesting thought in this day and age, sort of, as times change.
Absolutely.
So yeah, I've used some of these grief interventions with clients coping with illness, disability in terms of grieving for lost functioning or uh, activities. So that's an interesting one too.
Absolutely, absolutely. In the nursing home setting, I can kind of find myself using aspects pretty much and kind of doing some assessing from the aspect of the two-track model at time and looking at how that interactive but distinct and that they're kind of coming to a new level of organization with the fact that, for example, they can't walk like they used to, but they can use a walker and still get around. That they're not staying stuck in that fixed pattern of anxiety and depression, that they're progressively moving through, accepting that this is kind of the way things are now, kind of acute, and that pain is subsiding, and they're able to say with confidence to walk around and even leave the home, say, yeah, I've got to use this walker, but at least I can still get out and I'm doing it.
Yeah, we have a lot of questions rolling in, so I want to just say to everybody, we'll try to get to as many as we can, but apologize if we can't hit every one. Another interesting one that came in, Julie. Any comments about idealizing the deceased, holding on to possessions, creating an altar, or not changing the room and possessions of the deceased for many years?
I was going to say, for short term, you're okay, but we get to the point that they're like, they won't remove the clothes. It's really kind of a sense, what do keeping the room set up, is it more of a shrine or has that become a remembrance? If it's an area of remembrance, it's kind of more of a that they're working through, and this is what they want to keep to remember the person, versus the shrine component. That's where it's really, there's some more complex and complicated grief issues that need to be addressed. But I'll say a personal example. My husband's family member died, and for years they kept some of the clothes in the closet just because they felt that comfortable, that that's where they wanted. But in other situations, people have wanted those things out of the house the next day. Or the big issue I see coming up is when maybe a spouse is not ready to part with things a couple months afterwards, but the children come in and decide to take everything out of the home and say, we don't need mom's clothes around anymore. They have to go. But the husband that's still living there, or the dad, was kind of, he said he's parting with the things progressively. But the fact that he really wasn't ready to part with them yet can cause another type of complicated grief for families.
Excellent. Yeah, thank you so much. Let's see. Another question here. Oh, I will mention just real quick before I do this next question. I did post the link to the evaluation in the chat section so that everybody can grab that before they log off. And it'll also be sent out in a follow-up email to all the attendees as well. So don't worry, we'll get it to you one way or another. Yeah, another question here. Really appreciate the dual process. I have a client who, due to childhood abuse trauma, focuses on the loss of a normal adulthood. He has achieved facing and moving forward with some adult responsibilities, but is stuck grieving the losses, healthy marriage, role in family, etc. Does that make sense to you, Julie?
I don't want to speak too much on that one because I'm not too familiar at all in working with the abuse issues, and I don't want to lead someone very much in the wrong direction on that.
Yeah, definitely understandable. Okay, how do you work with a person who remains only in the grief process? Oh, sorry, excuse me. Who remains only in the grief processing without oscillating to a dual process?
It's like that's kind of shows maybe there's some more of a complexity going through. And also my question would be, how long has it been? If we're looking at just a week or 2 weeks or a month, then that's very normal to still be in that heavy, intense, acute grief phase. I would say even bringing up and exploring some of those oscillation aspects of restoration oriented. Have they thought about anything? How are they handling issues? You can get attuned to where they are with the depression if they're kind of figuring out the issues, like who's going to help with the finances, how am I going to do the laundry, Now, when my wife is the only one that ever did that, exploring what their thoughts are on their plans may be a way to kind of get that sparked and just see to see where they are on it.
How would you say these principles apply to children who are grieving? Does it make a big difference in kind of the process that they go through?
Because so many differences in personality exist, some of these may fit well with children. Other one may be a little bit too advanced that they're not cognitively at that point that they can process things. For children, really, it's before they get to the age of about 7 or 8, based on Piaget's kind of understandings and looking at concrete operational aspects of thought process, they really can't even understand the reality that a death has occurred. That cause effect thing kind of isn't there. But as children age more progressively, some aspects of the models may become more relevant. I'll give an example. I had a client I worked with a while ago that had a young child that was a grandchild that had been close to grandpa. And when grandpa died, the child was very small. And as he grew, he would ask different questions about the whole funeral, grandpa's death experience, as he was starting to kind of maybe come to the point that he could see both aspects and kind of construct his own story and meaning making of what happened. But this really depends on where the child is.
Great, yeah, that's awesome. Good to know. Yeah, we appreciate all the different comments and questions. We're kind of running up against the time here. I'll just, I'll throw one more out there that someone said. I just think it sums up sort of the presentation really nicely as social workers who are learning this about this topic. And they said, as a previous hospice social worker, it continues to surprise me how individualized passing really is, and what a privilege it is to walk with the person through a tough time like that.
Agreed. There's a sense of a life-changing experience for both them and for the clinician in working with dying and grieving populations.
Yeah, definitely. So yeah, thanks again to everybody for joining us today. Whether you were, here just kind of listening or interacting in the chat section, we had a lot of awesome questions and comments. There's definitely a lot of smart social workers on the call, so we appreciate you all being here. And thank you to Julie as well for taking the time to, share this knowledge with us. It's been a real pleasure.
Thank you very much. And I hope, like I said, that everybody walks away with some new way to approach or interact with dying and grieving individuals, that they can even help others in their colleagues, individuals in their settings understand and enhance death care.
Yeah, definitely. Yeah, and just one more time, I'll reiterate that the link to the evaluation is posted in the chat section. If you want to grab it now, I'll also be sending it out in a follow-up email shortly after we're done here, so you'll get that. And Julie has also, graciously kind of provided her email address to us. So if people have questions or comments or want to reach out afterwards, her information is also posted there in the chat section as well. So yeah, it's a big topic, and I feel like we've really learned a lot today. So thanks again, Julie, and thanks everybody for joining us.
Thank you.